Now, also a quick note for you guys as well. Fireworks are legal in the unincorporated parts of Horry County and in the city of Conway, but before ringing off the new year with a bang, officials with Myrtle Beach Fire Rescue want to make sure you do it safely. Never place any part of your body over a firework device when lighting the fuse. Also, never try to relight or pick up fireworks that have been fully ignited. And you should always keep a bucket of water or a garden hose in hand in case of a fire or a mishap. These things happen. You know, Captain Evans says if you don't feel comfortable, there's always some safe alternatives.
The very nature of fireworks can be dangerous, so we always recommend, going to one of the professional shows. You've got 2nd Avenue Pier, Market Common, Broadway at the Beach. You've got a lot of shows around here that are doing different things, so I recommend going to one of those and enjoying what they've got going on.
And they say if you do fire off some fireworks, dispose of them properly to avoid brush fires. One other thing to be cautious about are sparklers. Captain Evans says they can still be several hundred degrees hot even after burning. Now, a reminder, personal use of fireworks is prohibited along some parts of the Grand Strand. We mentioned the unincorporated area in Conway, but Myrtle Beach, North Myrtle Beach, and Surfside Beach, they don't allow it. Failure to comply could cost you $500 and up to 30 days in jail. All firework events must have a special permit by city or town leaders.
Tonight, leaders with the state's health agency, DHEC, are reporting that every county in South Carolina, except for 2, now have high spread of COVID-19. And Jasper and Allendale here are on the higher end of moderate spread. Now, this is a big change from just a couple of weeks ago when Marion County still had moderate spread.
This is flat out alarming for our state.
South Carolina's public health director speaking with journalists as COVID-19 cases are up 166% from this time last week and 435% from 2 weeks ago.
We know that the Omicron variant is spreading all throughout our state.
Scientists with the Medical University of South Carolina say from their sequencing test, Omicron is now dominant. Early studies show it's 2.5 times more contagious than Delta and could be more mild, but that might not be our case.
A lot of it's coming from communities that are not South Carolina, that are coming even a lot of times internationally.
Dr. Traxler says it might be mild in a country with high vaccination rates because shots protect against severe illness. But in South Carolina, that level of infection is up.
We have had 146 new COVID-19 admissions across the state, which is 102.8% higher than last week.
She says people fighting COVID in the ICU or on a ventilator has also increased.
It's easy to look at these big numbers from a statewide perspective. What's not easy is being one of the people who is breathing with the help of a ventilator, a machine forcing air through a small tube into your lungs, or being one of those unfortunate family members who has to hear the ultimate bad news from a healthcare professional that they've lost somebody near and dear to them and will never get to see them again.
Now, testing centers are already overwhelmed. DHEC tweeted today that some people could wait 1 to 2 hours just to take a COVID-19 test. Now, when we asked Dr. Traxler what DHEC's doing to navigate this testing demand, she first thanked South Carolinians for doing the responsible thing and getting tested after the holidays, but says they're rapidly increasing staff at these locations and they're working to navigate traffic flow to get people in and out quicker.
Well, Andrew, Dr. Paul Richardson from Conway Medical Center says it looks like we're repeating patterns when it comes to COVID numbers as we head into the new year.
We have no way of knowing the future, that's for sure. And what we do know is, or what I believe to be true is, this hopefully will move from pandemic to endemic. Endemic meaning basically like the flu.
Dr. Paul Richardson says it's hard to say what coronavirus will look like for South Carolinians in 2022. With Delta and Omicron variants surging cases across the U.S., Dr. Richardson says as a medical professional, he's concerned.
I certainly hope we don't get anywhere near, like those 50 and 60 inpatients. I mean, for many reasons. Number one is I don't want people sick, but number two is we know what it does to our healthcare system locally and nationally when we have that many folks requiring that level of intense services for that amount of time.
The CDC is reporting that Omicron is now the most dominant variant of coronavirus in the U.S., and it's more transmissible, meaning it's easily spread.
We don't know what it's going to lead to. With this spike, are we going to see more positive cases, but those don't translate into hospitalizations and requiring ICUs and ventilators and that kind of stuff.
With uncertainty in how the Omicron variant will carry into 2022 and throughout the year, Dr. Richardson says the best way to protect yourself from any strain of coronavirus is by making sure you get 3 shots of the vaccine or 2 shots of Johnson & Johnson.
Definitely long term, it does appear to be effective.
Dr. Richardson says medical data has shown long before coronavirus that good hand hygiene helps to prevent the spread of any infection. He says if people practice washing their hands more often and take additional precautions like wearing masks in crowded spaces and social distancing whenever possible, he believes we can significantly reduce the spread of the Omicron variant in 2022. Dr. Paul Richardson from Conway Medical Center says 2021 has not only surpassed 2020 influenza numbers, but both locally and nationally, he says we could also be seeing flu cases past pre-pandemic levels. With people going back to work, schools reopening, and fewer COVID restrictions, Dr. Paul Richardson says more contact between people is a major reason why we're seeing a rise in flu cases.
This one is really coming back with a vengeance to the point where we're looking like and tracking probably higher than we did season before last. Definitely it's going to be a big flu season for us.
And Dr. Richardson says the hardest part about identifying these rising influenza cases is because flu and COVID symptoms are so similar.
Fever. Sometimes it can be significant fever, but at least it's low-grade fever. You have congestion, you have cough, these malaise or just kind of feeling bad, fatigue, these kind of symptoms. So every single one of these mimic one another. Really no way to tell the difference, especially now, with COVID in the mix.
He says practicing good hand hygiene and staying home when you're sick are important, but Dr. Richardson says the best way to protect yourself and others is
vaccination. COVID, flu is still the key to lessening the severity and usually the time course of these illnesses.
He says this is especially important as the flu can be deadly for high-risk patients.
Your elderly, your folks with chronic medical conditions, especially like chronic lung diseases or immune system problems.
Dr. Richardson also says if you're feeling sick, the only way to be sure of what you have, whether it be COVID, a common cold, or the flu, is to get tested.